So this you just have to see to understand the complete and total disconnect from reality that has infected the Republican Party when it comes to the coronavirus pandemic. Republican Senator Ron Johnson appeared on Fox News over the weekend, and he was asked, could you ever get behind a vaccine mandate? We know you're not for one right now, but could you ever get behind the government mandating that people get a vaccine? And Ron Johnson said, I mean, it's completely beyond parody. He said, I could only do that. I could only support a vaccine mandate if there was a deadly disease spreading. Now, of course, he means more deadly than COVID. Let's take a look at the video and then discuss.
You see that if you have this virus and you spread the virus and you're unvaccinated, you have a chance of better chance of being hospitalized. But I don't think you can mandate someone get vaccinated. I'm pretty sure that we've never done that before. And it was a month ago when both Kamala Harris and the president said, I can't force anyone to do it. But Europe is doing that. Could you ever get behind a vaccine mandate for everybody?
No, not unless there's some incredibly deadly disease. I mean, much higher infection fatality rates than we have with COVID. We don't know the final infection fatality rate.
So he says he could only get behind a vaccine mandate if there was something really deadly spreading, to which he clearly is referring to something much deadlier than COVID. And then he later on went on to say, I'm not downplaying COVID, but, you know, something about the fatality rate of the flu, he said. Now, let's break this down in parts. This hopefully will be useful to some of you dealing with disinformation in your local communities, in your households, even based on the calls I got last week. The flu case fatality rate, the CFR, is about 0.1%. The COVID case fatality rate is 3.1%. That's 31 times higher than the flu. Now, you might say, wait, David, what do you mean 3.1%? I thought that the death rate of COVID was only 0.8%. Remember, we've got different metrics here. We're talking about the case fatality rate. That is deaths divided by known cases. Because of the number of unknown and never tested COVID cases for a variety of reasons, it is believed that the infection fatality rate is 0.8%. But here we're comparing the case fatality rate of flu and the case fatality rate of COVID, 3.1% for COVID, 0.1% for flu, 31 times higher. Okay. So that comparison is weird. Then you have, how infectious are they? R0, which is the R naught, is a measure of how infectious, how easily spreadable a condition is. The R naught for the flu is somewhere between 1 and 2. For COVID, the R naught was originally believed to be somewhat higher without taking any mitigation measures. So probably in the area of 2 to 4. And the whole point of the mitigation measures was to try to get it below 1 so it stops spreading. And the Delta variant is believed to be way more contagious. We're still learning, but it could be something like 5 to 7. We're not totally sure, but the Delta variant is dramatically more contagious. So the flu comparisons all would point to taking COVID really serious. Way more deadly and way more contagious than the flu. Now, of course, if you say, well, I want to compare it to something like Ebola, something really deadly. It is absolutely true that Ebola is really deadly. Ebola kills. The death rate of Ebola really varies depending on the medical facilities that are available. It's also a much smaller sample size, but Ebola's death rate is estimated at 25 to 90% of those infected. The infection fatality rate of Ebola is an average is about 50%. Now, a big portion of that is because of where Ebola happens. Ebola overwhelmingly takes place in poorer countries where people often end up dying of shock from fluid loss. That would likely be lower if Ebola was only in a country like the United States because of more advanced medicine and access to more advanced medicine. But there's no doubt COVID is way, way less deadly than Ebola. But it's way more contagious. Ebola is transmitted by bodily fluids, and it has an R naught of between 1.5 and 2.5. COVID, and especially the Delta variant, are way more contagious than Ebola because of how it spreads. So the point here is, when someone like Ron Johnson says, oh, I'd think about a vaccine mandate if we had a really serious, deadly virus spreading. What exactly does he mean? How deadly and how contagious? We have to be asking that, because when they say, oh, flu, well, hold on a second. Let's figure that out, because you could have something that's way more deadly, but way less contagious. And you could have a similar expected death toll because you're going to have fewer infections because it doesn't spread as easily with a higher death rate. And you could have the same number or more people die. My instinct is everything I just said isn't even a factor when someone like Ron Johnson says this. My guess is he'll say, I would look at a vaccine mandate if we had a serious disease spreading. And then you would go to him and you would say, okay, tell us exactly what disease combination of R naught and death rate would qualify as serious in your mind. And my instinct is he'll move on to the next talking point. I don't think they actually really know what they're saying. They're just coming up with something to not have to be in favor of a vaccine mandate now. And then if there was a different situation, he'd come up with a different reason to oppose it. These guys are clueless is the point that I'm trying to make.